Well, good morning. Just wanted to, just before I start, just talk about as a resident in training and incredibly long training that I have to go through, how inspiring and invigorating it is to come to conferences like this to talk to the patients, because I think it really, when you do research and you're looking at numbers and MRIs, there's like a somewhat of a disconnect down the road. And I think talking here kind of brings everything to fruition. So this morning, as Dr. Vez had mentioned, I wanted to talk about our pilot study that we've been working on, looking at posterior fossa volumes and its ability to predict clinical outcomes in Chiari malformation. First and foremost, obviously, I'd wanted to thank the ASAP for funding this project and inviting me to this to present our results. No conflicts of interest. I think you guys are well aware of Chiari 1 malformation and what it entails. But suffice it to say is that, at least in the literature, there's been associations related to the volume or the volume in the posterior fossa and the onset of symptoms and what have you. Most of these studies have been looking at what we call morphometric measurements, meaning you have a MRI and then you just do very linear measurements. More recent studies have looked at the 3D volumes, but the problem with these studies, and Dr. Grant's talk in one of the more recent papers looking at 3D volumes, is that it's very labor intensive. So essentially what you do is there are a lot of programs. In this case with Dr. Grant's talk, with that paper, they used this program called FreeSurfer, which is a program where you have somebody just basically sit there and outline the volumes. And so in that regard, because it's so labor intensive, they can't do as many patients and look at the volumes because it just takes too much time. So there have been a couple of studies looking at automatic segmentation. Basically what it is you develop an algorithm and you have the computer outline and generate the volumes for you. And obviously in this regard, it can increase efficiency and reduce labor and demand. We thus, in this regard, sought to utilize automatic segmentation and utilize and develop a user-friendly graphic user interface to segment these patients. And in this pilot study, what we did was, once we developed this program, we sought to compare the preoperative and postoperative volumes, posterior fossa volumes in patients with symptomatic Chiari 1. And then look at the relationship with the postoperative volume changes with symptomatic resolution. At Children's National, I've been fortunate enough, with Dr. Keating's help and the Chiari team, to have a very large cohort that I can have access to. For the most part, these patients, obviously, diagnosed with Chiari 1, all children, and have had have had symptoms, underwent surgical decompression between the years of 2005 to 2013. Patients were excluded if they didn't have a preoperative and postoperative MRI to compare. A lot of these situations, these patients are coming in from out of town, and so we don't have the images to immediately, or for me to access. As far as the outcomes, what we looked at really were two variables. One was clinical and one was radiographic, which, clinical obviously being if they had symptoms which are listed here, and then the radiographic findings, where there be syrinx or kinking or basilar invagination. For this, again, preliminary study, we included 36 patients. The average age was about 7 years, and then the mean follow-up time was about 2.5 years, give or take a year or so, a couple of years or so. This is the graphic user interface that we developed. What it is and again, I want to emphasize the key difference between this study and the prior 3D segmentation tools is that it's not only, as I said, user-friendly, for the physician or whoever's interested in looking at volume or developing volumes, but it's also very fast. And I think in the past, and I've used a couple of the other programs to manually segment, it would take upwards of 30 or 40 minutes to get very accurate 3D volumes. But in this case, it took, at the outset, maybe 10 minutes, and then once you get good at it, it can be under 5 minutes. The way this works, and in contrast to other 3D tools, prior to other tools utilize, say for example, a generic atlas, and then they use that generic atlas to generate the volumes. What we did was we used MATLAB, and one of my colleagues, Chiari, who's not here, we generated this tool where you can you look at the axial slices, it generates a midline slice. So instead of the axial slices look like this, they cut like that, and then we generate a cut like this to kind of look at the brain across. You choose the boundaries, and then from there it's able to generate a one segment for you, and then once you verify that that's the area that you're looking at, it can automatically segment, and then from there you can calculate the volumes. This is an example of a patient where we were able to overlay the preoperative and postoperative to at least visually appreciate the difference in the posterior fossa volumes. As far as our clinical outcomes, there are a multitude of variations as far as improvements. The ones that we decided to look into were the ones in red for the very fact that it had a larger sample size and we felt a little more comfortable looking at that. Like for example, patients with hoarseness, there were not as many, and so it's very hard to compare with a limited cohort. The posterior fossa volume change was significantly associated with improvements in headache, tonsillar descent, as well as kinking, cervical medullary kinking, and overall surgical success, which is defined as either clinical or radiographic resolution that prompted the surgery initially. So in summary, in this pilot study, what we found was that there were improvements, again, in headache, descent, tonsillar descent, and kinking, and overall surgical success were associated with a higher degree of posterior fossa volume increases postoperatively. Because this tool that we've developed at Children's is very user-friendly and it's very efficient, we can, at this point, broaden our scope and include many more patients in the study and increase the robustness and generalizability. And from there, in this particular study, what we looked at was only patients with symptoms. As the other prior speakers had mentioned, there are a lot of things that people wonder about, specifically with Chiari, with regards to anything from incidental finding, like if they don't have symptoms, to subsequently developing symptoms, and what the relationship of that is with subsequent changes in their volumes. If they, as they grow, does their volume decrease or what have you. And so what we can do is utilize this cohort that we have, this database at Children's, and then start looking into that more rigorously. I wanted to thank Dr. Keating and the research team over there, specifically Tiffany, who's here. Hi, Tiffany. For kind of helping me gather the data and kind of getting everything through, because obviously as a resident, it's a lot of work. All right, that's it.